I want to know how you would treat a patient that has TMD and it has not really resolved. They've gone to different dentists and different neurologists, and they just have had a problem and they're still in pain.
Okay. Well, first of all, most dentists, when they hear of a TMJ problem or a TMD problem, they have to first be able to diagnose it properly. And the diagnosis is not just pain in the joint, because the pain in the joint can be coming from a neck problem. It could even be coming from a postural problem. It could be coming from a muscle spasm problem. It could even be related to a problem in their hips. So when you go to a dentist and they give you an appliance, let's say they give you an upper plastic appliance, the first thing I tell patients is it's not magic plastic. There's more to treating a TMJ problem than just putting an appliance in the mouth. Plus, many appliances that are made on the top of the mouth actually restrict the cranium, the flow, the pulsing of the maxillary sutures, and that restricts the patient even more and makes the problem worse. What we try to do is make a lower appliance that's very small so it doesn't intrude on the muscles of mastication, and they can wear it during the day part-time. They can wear it when they exercise, and it helps them reposition the mandible to the whole skull, which helps the posture. But here's the most important part of patients who are having a TMJ problem. First of all, you have to make sure that it is a TMJ problem, because a lot of times they have facial pain, and it may not be the joints, it could be something else. It could be referred from the neck. So we work with special practitioners, whether they're physical therapists or specifically trained chiropractors. Not every chiropractor knows how to treat a TMJ patient. Or we work with osteopaths who understand the whole cranial mandibular complex, and they can actually balance the muscles and the skeleton and the spine, not just up here, but down here in the lower back, so the patient is functioning in a very balanced biological way. So it's so important that you don't just look at the joint, you look at the posture of the patient, but you also have to look at the nutrition, the emotional balance of the patient. There's so many things that go into what's causing a TMJ problem. It's not just one modality, and it's really important that the patient know that it's a multifactorial issue. It could be, I have patients who come in, and just because of their posture working in front of a computer, if we just change that, they don't even need splint therapy. They just need to know how to sit in front of a computer, and that gets rid of their pain that they have. So it's it really is, you need to say and sit down with the patient and have a good conversation about, well, what are you doing in your whole free life, your lifestyle, your work posture, your work style? What are you doing that could be potentially causing these problems? And after a good evaluation, you know what direction to go in, and then you can treat the patient. But don't get fooled to think, oh, I need an appliance and then I'll be fine. Because we get patients who come to us who have bags full of appliances, and it's really not the appliance, it's what is done with the appliance, how it's balanced. And we have special practitioners who understand this whole myofascial cranial mandibular complex that needs to be working in conjunction with the whole body. Okay? So that's what we do for our patients. And please don't get fooled to saying that you need surgery. Surgery is the last thing you need, and surgery is not your answer, because just because you do surgery over here, you haven't corrected the cause of the problem. So you need to really address the cause of the problem.
When a patient has periodontal disease and they do not want to see a periodontist, how would you suggest treatment or modalities of treatment, including use of the microscope?
Well,
recommend antibiotics when you do find bacteria?
Well, we'll discuss antibiotics later on, okay? But here's the first and most important point. If you have an infected mouth, if you have loss of bone, you have a destructive process going on. our first job is to find out why are you losing your bone. Okay, so if you think by having gum surgery and reducing the gum height, which makes the teeth more cleansable, that's an immediate, quick fix. But for the problem that you're seeing, but it's not addressing the problem that's causing you to get there. Because we know from studies that 10 years later, and I've seen this time and time again over the last 15 years, that you'll come back 10 years later and you'll still need gum surgery again. So what we stress with our patients is that you need to address the cause of the problem. And it's so important, A, to look to see if, well, do you have a bacterial infection which is seen with gum disease? But then how are you measuring that? You all have experience going to the doctor and you've had cultures if you had swollen tonsils. Red and swollen tonsils, well, equates that to red and swollen gums. And if you go to your doctor, standard of care for a medical doctor is to do a culture to see if you have strep throat. Well, why isn't standard of care for the dental community to see if you have a bacterial infection causing this destruction? And why isn't it measured? Why isn't it dealt with on an ongoing basis? That's what you need to do. But what about the patient who has gum disease and has bone loss but doesn't have bacteria, which we test in our office? Well, then that's a nutritionally deficient patient. Well, now you need to spend a conversation excuse me, about dealing with the nutrition of the patient, whether it's lack of calcium, lack of vitamin D, lack of antioxidants, or what you're eating, what you're allergic to, what your bowel movement's like. There's so many different issues that can be causing your gum disease. But here's the most important thing you need to realize. If you think cutting away your gums is going to solve your problem, it's not. And here's the issue, okay? Look at the beauty of the mouth is it's like a barometer of your overall health. Okay, and what a barometer does, it's not a thermometer. A barometer actually predicts the weather a week ahead. And you've all played with it when you were young, and you clicked on you tapped on the window, and you saw the needle move, and you knew that it's going to be sunny next week or it's going to be raining next week because it's a barometer. It predicts future weather. Well, your mouth is the same way. Your mouth is a barometer for your health, and if you're having breakdown in your mouth, I promise you there's a large probability you're having breakdown in the rest of your body. And what I want to stress to you is by just covering it up, by cutting out your diseased gums, or even taking fluoride, if you think it's going to prevent cavities, sure, you might be band-aiding the effect, but you're not correcting the pathology that's going on that is also affecting your overall health. So what we do is we look at your pH. We want to make sure you're at the proper pH, because then we know that if you're not too acidic, the mouth is going to be rebuilding as opposed to breaking down. So you can have gum surgery today, but I promise you if you're still acidic tomorrow, in the next 5 or 10 years, you'll be in the same position you are right now. And if you have gum surgery, but you know what? 2 months, 3 months down the road, if you have the same bacteria that got you in this situation and it hasn't been dealt with, and if you have diabetes, you know what? It's going to still affect your insulin levels the same way, and you're still going to be dependent on all your medication. Our goal is to address the infection that has a direct cause on your overall health, and then we can help you not only correct your disease that's going on in your mouth, but help you stay healthy or healthier for your overall systemic health. And this isn't voodoo, this isn't holistic medicine, this is wellness medicine. This is things that are in every medical journal today. This is the biggest thing going on in dentistry. We can't even discuss with the time we have today on how sleep apnea and not breathing problems affects your overall health in terms of causing gum disease. But I can tell you that gum disease has an implication in heart disease. I can tell you that gum disease, having cavities has an implication in heart disease. Having sleep apnea has an implication in heart disease. And isn't it great that you can go to your dentist and he can actually evaluate and give you, by testing your endothelial cells, to tell you if you're going to have a heart attack in 10 years. that's what the future of dentistry is going to be about, and that's what we're trying to teach you and educate you about, that we can give you a peek into your future and keep you healthy so you don't have to deal with having disease in the future. If you think about, a big word today is sustainable, being sustainable with the earth and having sustainable principles. But your body is also follows the same principles. You've come from the earth. We're all part of this amazing earth that we live in, and we follow the same sustainable principles. Just like a tree that's affected by acid rain, which comes from the pollutants from industrial factories, they make the rain more acidic. So what happens? You look at a tree which looks beautiful, but if you look at the top of the tree, because it's not getting its minerals, it's not alkaline enough, the top of the tree is starting to die and wither away. Well, the mouth is the top of the tree, and if you're still too acidic, you're going to be withering away. And that's why we have our patients test their pH with special strips. They test their urine in the morning. So we want to know if they're either acidic or alkaline, and then we put them to a program that will make them more alkaline so that they can have a healing process. If you continue with the same treatment you've been used to, and you don't deal with the basic foundations of proper nutrition, and I'm not telling you to become a vegan or a vegetarian, I'm telling you just to have basic principles of becoming alkaline, then your body will heal itself and you'll be much healthier, and you won't need to go through all this painful, costly extraction and implants. You can save your teeth, and you can smile knowing that you have your own teeth, and you can save a lot of money.
Thank you so much for your great insight and this explanation that has been wonderful for all our patients, that we know that is really going to help us.
Oh, it's my pleasure.
God
Thank
bless
you.
you.
Thank you very much.